There were other people with him as well. They went after them and killed my brother and the other civilians as well.
ABC Investigations has confirmed this account of unarmed civilians being shot near a tractor with Australian sources who have knowledge of this raid. They tell us that up to 10 civilians were killed, that members of Zulu 1 Patrol were responsible, and that some in that patrol were unhappy with what unfolded that December day. A long-running inquiry by the Inspector-General of the Australian Defence Force into alleged war crimes by Australian Special Forces in Afghanistan is expected to be finalised soon.
Mark Willesee reporting. Victoria's struggle to contain the coronavirus remains the focus in Australia, yet the number of cases linked to a cluster in Sydney is also growing. Health authorities are furiously undergoing testing and contact tracing to prevent this outbreak from spreading and to stop New South Wales following the same path as its southern neighbour. The ABC's Gavin Coote reports.
In Australia's two biggest states, the list of coronavirus clusters is long and growing. From public housing towers, schools, abattoirs and aged care homes in Melbourne to an increasing number of cases linked to a Sydney pub.
It just shows how easily this can happen and how important it is to have that really prompt identification of cases, rapid contact tracing.
Julie Leask is a professor of public health at the University of Sydney. She's been watching as an outbreak that began with just 2 cases among patrons at a hotel in southwest Sydney has grown to more than 20, sparking a flurry of contact tracing and also cleaning at other nearby venues, including a gym and a shopping centre.
It says to all of us that we can't be complacent about COVID. It can come back, and we need to keep up those core prevention measures. So the rapid testing, isolating if unwell, and also the very prompt contact tracing that we have in government and with businesses. So you're not letting anyone slip through, so it's much easier to contact people if you find that there is a case. And then obviously, you know, the capacity of governments to respond. And all of those things help us get a hold of these small outbreaks that then hopefully don't become larger like we've seen in Victoria.
What is a size and scale of a cluster that is manageable?
Essentially, the principle is that you want to keep the disease's reproductive number, so the average number of people that are infected, if from one person, below 1.
As Melbourne grapples with its coronavirus crisis and Sydney teeters on the brink of a worrying outbreak, Perth is about to host 2 AFL matches with crowds of up to 30,000 at each game. Professor Michaela Lucas is an immunologist with the University of Western Australia.
At one point, we do have to make this step to larger people gatherings. And at one point, it's no longer justified of playing the fear factor and being extra cautious, particularly if you have no evidence that is necessary.
The AFL games will be some of the biggest public gatherings since the pandemic began. Professor Lucas is confident that WA authorities will be able to manage any small COVID outbreak, provided it's detected early on.
Gavin Coote reporting there, and the New South Wales government has announced it is lowering its limits on the number of people allowed in pubs. To the United States now, and California is taking another big step backwards. The state is one of several across the US struggling to contain a surge in coronavirus cases. Now, the governor has ordered the sweeping closures of public places. Bars are to close once again, and indoor dining is also off the table. Texas, meanwhile, is another state that's struggling. It set a record for new cases today. The mayor of Houston earlier this morning outlined his proposal for a 2-week shutdown of the city. And then there's Florida, which yesterday announced a record increase in new daily cases. That was a record for any state in America. That's where CNN's Nick Watt begins his report.
Florida is smashing records. More than 15,000 new COVID cases Sunday, the most logged in any state, any day, ever.
We have to get control of these numbers. These numbers are out of control.
The number of COVID patients in Miami-Dade hospitals is up 65% in just 2 weeks. The number in the ICU is up 67%. Those on ventilators up 129%. Miami might have to reverse reopening.
If we get to a point where we don't feel that we can care for the people that are getting sick, that's something that we're going to have to strongly look at.
Disney World just opened 2 parks, but if you don't wear a mask, you won't get the photo from your ride. Seriously, that's part of the enforcement. The NBA is planning to play in a bubble in Florida, but among the players who've now tested positive, Russell Westbrook. NHL teams started training today, but 9 Pittsburgh Penguins pulled after possible exposure.
What we believe is we go through this screening process and we actually get to...
That's fine. All right, thank you everybody, and thanks for waiting in the rain. This morning, as you can see, I visited the Auckland Airport and the Jet Park Hotel. I'll be visiting the airport in the afternoon and having a walk through there. And everybody arriving in New Zealand, of course, must be isolated for 14 days. And then they must test negative for COVID-19 before they can be released into the community. Anyone arriving with symptoms of COVID-19 on arrival or testing positive after arrival will end up here at the quarantine facility at Jet Park or at a different quarantine facility. But if they're in managed isolation, they'll be transferred into the quarantine facilities. So there are 244 returnees here at the Jet Park today. So as part of the tour this morning, I've been able to see firsthand the quarantine facility, the protection measures that are being put in place. I've spoken to defence staff and health staff who are working here. As with other parts of the country's COVID-19 response, I do want to acknowledge all of the staff who are working here for their professionalism and their dedication. They are doing a fantastic job on behalf of all New Zealanders in keeping everybody safe. Again, for reasons of health and safety, as with my visit yesterday down in Wellington, I've not spoken to any of the individual people who are quarantining whilst they are here, but I have had a good opportunity to speak to all of the staff who are working with them and see exactly how they're managing things so that everybody is kept safe. So, in terms of the COVID update, today there is 1 new case of COVID-19 who was in managed isolation in New Zealand. It's been 74 days since the last case of COVID-19 was acquired locally from an unknown source. Today's new case is a woman in her 60s who arrived in New Zealand on the 30th of June from Pakistan and had travelled via Doha and Sydney. She's been in managed isolation at the Novotel in Christchurch and tested negative on her first test, her day 3 test, and then tested positive on her day 12 test. So I do want to reiterate again, this is the reason why we do testing over a period of time, why we're testing people near to their arrival and near to their departure. That aligns with the incubation period for the virus. It means that we can be certain that nobody is being released until they have they've been cleared of COVID-19. So the second test around day 12 is important because of the period of time it can take for some people to incubate the virus and to test positive. So that brings our total number of confirmed cases to 1,195, which is what gets reported to the World Health Organization. One previously reported case is reported to have now recovered, which means our overall numbers of current positives remains the same at 25. There is nobody receiving hospital level care here in New Zealand as of today. I will just check the second page. I'll keep this brief. 1,620 tests were conducted yesterday, which brings the total number of tests completed to 431,263. I've mentioned before the importance of people downloading the COVID Tracer app. Dr. Bloomfeld mentioned that in his briefings yesterday as well, and I do want to reiterate again to New Zealanders, it is important that we all play our part by preparing for any future need to contact trace, and we can all do that by downloading the app, by using the app and by keeping a record. The latest update to the app will be out in a couple of weeks. That will allow people to manually enter in additional appointments where QR codes might not be present, like when they're visiting friends, family and relatives and so on. And I've also checked, based on a question from your colleagues in Wellington yesterday, that the ability to add appointments or add contacts retrospectively will also be included in that as well. So if you forget to scan somewhere, you remember afterwards and you want to add it retrospectively, you'll be able to do that as well. So that functionality will all be included in the next update of the app, which will be released. Just one final message on testing. As I've mentioned earlier, or actually mentioned last week, the government is concerned about the overall downward trend in the rate of testing. I've been working with the Ministry of Health on a new strategy around that to make sure that we're getting those testing numbers back up again. They'll be issuing further guidance to general practitioners and to others later on today, by the end of today, to ensure that we are increasing our overall testing rates. They are certainly aware of the fact that the current rate of testing isn't where it needs to be. We have gone back and checked though, and as well as testing numbers going down on the weekend, we've also seen evidence that testing numbers go down during the school holidays as well. And so we are, of course, in the middle of the second week of the school holidays, but we do want to see the overall rate of testing going back up again, and health officials will be working by the end of the day to issue revised guidance so that those testing numbers can come back up again. And with that, I'll hand this to Richard, and I'm happy to answer your questions. No, she had not been released from quarantine. She was in one of the managed isolation facilities in Christchurch. So she will, because that's also a quarantine facility, she'll remain in that. But obviously the level of care that she receives, we have a slightly higher level of supervision and care for people who are in quarantine versus in managed isolation. So all of the protocols around that will now kick in. But she's not been released. All of our positive results in New Zealand as of today are in managed isolation or in quarantine.
The chartered flight from Australia that's landed this morning, where have they gone to, and what has the process been with their arrival?
So they were processed as all incoming flights are processed. They've been taken to a hotel where there is an extra security, as I mentioned yesterday, because it's important that the public have that extra reassurance. Given the profile of the cohort of people who have been arriving this morning, I understand that they've all now arrived at that hotel. They've all been checked in. Everybody's following the rules, and there haven't been any issues with that.
What exactly is that extra security? Have they got someone outside their door, or is it just security at the gates?
It's a combination of the venue, so making sure that the venue is very secure. The selection of the venue, I think, was undertaken on that basis, that it was a venue that was that could be secured well. And then, of course, there are additional security, additional police and Defence Force personnel there, just to make sure, give us all reassurance that nothing's going to go wrong there. No, they don't have door-to-door supervision. We haven't done that for anybody who's in managed isolation or quarantine. We are confident, though, that all of the relevant security measures at that hotel are put in place so that they're not going to be coming out into the community. And as I said, the feedback that I've had so far this morning is that this group are very cooperative. They're all following the rules, they're all checked in, and they're all doing what they should be doing.
And what is the Ministry doing to assess people before they are sent to isolation to ensure they have the appropriate medical support? Is there any specific support for vulnerable people?
Yes, so there's a health check at the airport. That health check will look for any visible signs of COVID-19. It will also look for any other issues that may need to be, where assistance may need to be provided, such as mental health issues. That's all done at the airport. People are then triaged into either managed isolation if they're not showing any symptoms and they're deemed to be suitable for managed isolation, or into quarantine if they're showing symptoms at the airport. They go straight to quarantine. Testing happens once they're in the facilities. Because of the turnaround times, it's not practical to keep everybody at the airport while we wait for test results to come in.
And what about mental health support while they're in managed isolation? What does that look like?
So there are mental health supports available. There's both formal and informal mental health support that's available here. Again, I want to acknowledge the staff who are working in these facilities. They are all bending over backwards to provide additional support to people who are here. Sometimes simply being nice to someone, talking to them, if they're just a bit stressed out, that has been enough for those people to actually leave here at the end of their stay feeling confident and feeling reassured. In other cases, they need additional help. It might be counselling, it might be other things, and those things are all available to them here.
And the Deputy PM of the Cook Islands has said that quarantine-free travel will be announced in the next week. Is this correct?
So the New Zealand government is speaking to the realm countries about when travel between our countries might resume. Obviously the realm countries are a priority for us, and our Prime Minister's been clear that we haven't set a particular time frame around that yet. Of course we want to do that when we can and when we can do that safely, but Cabinet, the New Zealand Cabinet's not made any decisions on that, so that matter would go to Cabinet before there's a final decision confirmed.
And would that have any impact on the Trans-Tasman bubble?
No, I mean, we do have a different relationship with the realm countries, so that's one of the reasons why we're working slightly differently with them. But of course, we're still continuing to talk to Australia as well about when we may be able to resume on a safe basis travel between Australia and New Zealand.
Are there any concerns that additional people may have been in contact with this one who's now tested positive? And is anyone's 14-day countdown being reset? Is it testing as a result of a positive?
No, when people come in, obviously there's very, very clear contact tracing whilst they're in the facilities. So there is no risk to anybody outside of their bubble within the facilities. If somebody tests positive who has other people in their bubble in a facility, for example, there might be a family coming back together where someone tests positive. I've just been through all of that with the health professionals here at Jet Park just to test that my understanding of what's happening is actually what's happening on the ground, and that's absolutely the case. I'm very reassured by that. So if you're, say, a couple, someone tests positive on day 12, that resets the clock for both people, so that everybody's staying here until we're absolutely certain that there's no risk of them taking COVID out into the community.
Any idea why the deportees this morning were wearing masks when they were being loaded to the airport?
That's something that you'd have to speak to Air Commodore Webb about, a logistical issue like that. Obviously, there are good protocols in place about how risks are managed and so on. These people will go into 14 days of quarantine or isolation, regardless of any risk factors that may have been present at the airport. We basically assume that anybody coming through the airport is at risk of having COVID-19, and that's why they go into managed isolation or quarantine. And everybody working at the airport who they may come into contact with is taking all of the precautionary measures on the basis that anyone they're interacting with who's coming off a plane could have COVID-19. Look, not necessarily. Again, that's a decision for the people who are managing this process to make decisions on. But as I say, they all go into 14 days of isolation from this point anyway. And as I've said also, all of the staff, all of the people interacting with them will be fully PPE'd, and they will also be taking all of the precautionary measures they take to ensure that they are not going to pick up anything that a passenger may be bringing with them. My understanding, there's 3 or 4 issues that we're grappling with over the last week. I know that charges have been laid. I won't get into each individual case, obviously, but charges have been laid where it was appropriate to do that. Look, I just don't have that information with me at the time, and I don't want to confuse that one with one of the other ones, but I know that where it was appropriate, charges have been laid against people who have broken the rules. The government's expectation on that, of course, is very clear, that we do want to take a zero tolerance approach to people who are breaking the rules.
Minister, just on the Cook Islands, can you clarify, is that going to Cabinet this coming Monday, next week?
Look, I don't know the timetable for that. Our Prime Minister has been very clear, the New Zealand Prime Minister has been very clear that we do want to work with the realm countries, and we want to resume travel between New Zealand and the realm countries when we can, and do so safely. But nobody in New Zealand wants to be responsible for any increase in risk in the Cook Islands or in the Pacific. New Zealand and Australia in the past have been transmitters of infection into the Pacific, and we don't want to do that again in the future.
Cook Islands Deputy though confirmed this morning. Has he jumped the gun, or has he got the wrong end of the stick?
Look, there are discussions. There are active discussions between the two countries. Absolutely. When we're in a position to make an announcement on when travel will resume, of course we will do so. But at this point, particular timetables are a bit premature.
Just on COVID testing numbers,
Yeah.
You want 4,000 a day, but how many people are actually being declined to test from clinicians, regardless of what the guidance is? If 4,000 people are putting their hand up, are you going to look at some sort of mandatory testing or sentinel testing in the community, people that aren't volunteering necessarily?
That's one of the things that the Ministry of Health will be issuing better guidance on, later on today, because we want to ensure that we are providing good, robust testing for anybody who's in that higher risk category. But we also then want to make sure we're maintaining a good, sound base level of testing in the community to be sure that if there's any COVID-19 out there, that we're picking it up. Now, we had a big surge in testing about just under 2 weeks ago. That gives us confidence that if there had been any COVID-19 lurking about at that point, that we would have started to see some evidence of that. But there's no reason, there's no room for complacency here, which is why we're not see those test numbers coming back up again, just to give us that reassurance. Now, it's most likely that as those testing numbers come up again, all that's going to show us is that they all come back negative because there is no COVID-19 in the community. But it will be a reassurance for New Zealanders. Look, I think it's highly likely that there are enough people with flu-like symptoms or an at-risk demographics who are looking for testing that we won't have to do anything around mandatory testing.
Last question on St John.
Yes.
Been making a bit of noise about funding. Is it at all on your radar or consideration for fully fund St John?
Look, ambulance services is something that my predecessor, David Clark, was doing quite a bit of work on. I've only had a preliminary conversation about that so far, so I'm not in a position to make any further comment on that today. But it's certainly on the radar, the issue around emergency services generally, and we'll keep looking at that.
Minister, One News understands that 12 COVID tests have been misplaced for the guests at the Robital hours, meaning that the guests can't leave. What do you know about that?
So my understanding is that there was just a tracing issue, just to make sure that the right test results were associated with the right people. It is a manual process. I've been given a reassurance that will all be resolved by the end of the day, and that people's departure will not be affected by this. There are good processes in place. They're just being very cautious.
We've spoken to a man who had his day 12 test on Saturday. His family got their negative test back on Sunday. He was told he was missing his was missing last night. How can this have happened?
Like I said, it's a manual process, and the advice that I've had is that will all be resolved by the end of the day. I first became aware of this about an hour ago, so there will now be a process to look back at and to make sure that if there are any gaps in the system, that they are resolved so that this doesn't happen again.
Does this mean that the labs are overloaded and not able to manage at the moment?
No, the labs are doing very, very well. One of the issues, as I said, is it's a manual system. We are moving to a digitised system, which will make the tracing that much quicker and that much easier. But as you can imagine, the whole system around testing was set up very quickly, and the IT systems to support that have been developed, and so they will be starting to be used very shortly, and that will help us to avoid these sorts of problems in the future.
What's your message to his family who have had to scrap all their plans to get reset?
Look, I do understand the frustration. The advice that I've had, though, from health is that their departure will not be delayed by this. The only thing that would delay their departure if one of the test results was positive, obviously.
Minister, what was the feeling from staff inside Jet Park as they seem to give anyone who's testing positive? Are they any concern?
What I saw there was a really professional, dedicated group of people who are going out of their way to care for people who are here in quarantine. Some of the people here in quarantine are sick, of course. They have COVID-19, or they have something else that has COVID-19-like symptoms. They may have the flu, for example. They're going out of their way to care for them. They're very, very professional. They're taking all of the precautions that we would expect them to take. They're dealing with any additional health issues that may arise, whether that's mental health or other health issues. So I was very, very impressed with the level of commitment that I saw from the staff. They are all, I think, very community spirited. I think they're enjoying the work. It is challenging work, of course. They're being very careful, but actually I think they're a very dedicated and professional bunch. It depends on what they're doing. So there are obviously cold zones in there, which are safe zones where they don't have to wear PPE, where there are nobody comes in or out of them without being disinfected, if you like. So I went into one of those zones, so you have to wear a mask and sanitize before you go in. When you take off your mask and all your PPE when you go in, it's basically just like being at home, so perfectly safe. As soon as you move out of there, then all the PPE comes back on. So they've got some nice areas there where they can relax and they can have a meal and they can look after themselves. But outside of those areas, the PPE systems are very, very robust.
Minister, given the events of this morning, how would you describe the state of the National Party?
Look, it's a matter for the National Party. I do acknowledge it's a difficult time for them, but really that's an internal issue for them to resolve.
Todd Muller has said that politics can be demanding and it takes a toll on you. How right is that?
Look, I think politics is demanding. It can take a toll on you. Some people cope better with that than others. I've known Todd Muller since he first became an MP. I've sat on a select committee with him. I do believe that he is a man of great integrity. He's an honest and decent guy who I think had a really good crack at the job. And so I just want to extend my thoughts to him and to his family.
Labour has been through its own leadership difficulties. How difficult is this time for the National
look, again, that's something for them. To be honest, I haven't had a huge amount of time to think about it. I've got a little bit on my plate at myself at the moment. I'm very happy not to be in that position at the moment. Yeah. All right. Thanks, everybody. Cheers.